It's a good caption. Go on to Facebook. We got a lot of stuff going on, and we'll check back in later on in the show.
Thanks so much, Chastity. All right, good to say we're all on the same page with Octomom. You guys rock. All right, moving on, though. If your doctor has told you that you need a hysterectomy, you might want to look into the DaVinci hysterectomy. It's offered at Azalea City Physicians for Women at Springhill Medical Center in Mobile. The DaVinci procedure offers several potential benefits over traditional approaches, including less pain, fewer complications, and quicker recovery time. Dr. Glenn Gallaspy III gives you a closer look at the DaVinci hysterectomy.
All right, so Dr. Gallaspy and I are about to check out the DaVinci robot. He's going to show me exactly how it works, right?
That's right.
But you know me, and I have to enter the OR in style. Yes, scrubs and heels. You ready?
Let's do it.
Let's do it. Okay, so talk to me about the DaVinci robot. It's actually it's kind of doing the surgery for us, but not really. Help us understand that.
Well, that's actually a common misconception. The robot is not operating on the patient. It's just a sophisticated instrument that is controlled by the physician.
So when you're back in your little gaming area back here, because it's almost like a giant video game when you look at it through the lens, and it's really, really interesting, but you are actually doing the operation. It's not you're in another room having coffee and the robot's in here operating on someone, right?
Absolutely not. This is the patient cart with all the robotic arms that hold the instruments. These instruments will be through the skin in the abdominal cavity, and the surgeon will control them from the surgeon console.
What kind of operations can this DaVinci robot perform?
Well, presently it's being used for gynecology, urology, cardiothoracic, general surgery, and head and neck surgery. Typically I use it to perform hysterectomies, myomectomies, and bladder repairs.
How many surgeries have you done? You actually train on this machine, right? You train other doctors?
Yes, I do. I'm a proctor for DaVinci. Gosh, I've done many hundreds. I've been doing robotic surgery since my training and residency for the past 6 years.
Wow. Now, what is the advantage for someone that's coming in having surgery to get surgery with the robot?
Well, for a patient, because they won't have to have a traditional incision, they're going to have less bleeding, less pain, less scarring, less complications, and a faster recovery time.
We'd like that. What is a typical recovery time for a hysterectomy?
My patients will typically go home in less than 24 hours.
Wow.
They will be back to work in less than 2 weeks, which is about a month faster than traditional surgery.
And you said less bleeding, less pain.
Absolutely.
I know your nurse said earlier that sometimes patients can wake up and not need the pain medicine after having this.
I've had patients that just take regular Motrin or come back within a week or for a few days and give me back their pain medicine and say I'm ready to go back to work.
So there really are a lot of advantages.
Absolutely.
Less costly, less scarring, less painful, less bleeding. So it's a good thing.
That's right.
You gotta love technology. I mean, really, less pain, that sells it for me. If you would like to read about the robotic hysterectomy, you can go to the Studio 10 tab on fox10tv.com. All right, coming up next on Studio 10, we are in the kitchen at Bamboo Steakhouse. I'll show you how my sushi rolls are coming along, and you can see